Okay, now with the hospitals or any healthcare environment, we need to start with our security program, all the policies and SOPs that are going to create the system that we're looking for. And we can begin this whole process by looking at both physical and psychological security safeguards that have proven to work in this environment in the past. And the reason why we start there is because we start the layering effect and see if those safeguards will work very specifically in the environment that you are working for. So let's begin with the psychological safeguards. Psychological, that means getting into the minds of people. But who are we talking about? We want three specific groups to think that our security system is top shelf. That means we're looking at your staff, the patients, the visitors. All three categories must think that the security system at your facility or at your hospital is so well carried out that it's just not worth trying anything. Now, psychological safeguards are most effective towards proactive and planned criminal activities. It's not going to be a big help against those spur of the moment violent reactions. So we don't expect that. However, we need to start our first layer. So let's look at signage and video display monitors. You want there to be a very clear message that your hospital takes security serious and that there are people there to help people, especially visitors, move from point A to point B so that way they're not wandering around. Also, at the information centers or the login stations, we want visitor badging to be taking place. We want sign-in logs to be effective. What about your marking and your labeling? And what we're talking about there is the wayfinder signs, doors, hallways. Hospitals tend to be huge. And they used to be a simple building called a hospital, but now they are what? Healthcare campuses. So your markings should really help people out as far as finding their way around and as far as keeping, for those of you on the safety side of the house, keeping you in compliance with your occupational and safety health requirements. Now, focusing really on the staff here, we want there to be a mindset that says, hey, our employer or this hospital takes incident investigation very seriously and they don't waste any time when they're doing it. They complete quality investigations, and if we've done something wrong, we're going to get busted. So how about we just don't do anything wrong? That's what you want going on in the minds of your staff. On that same road, we want to look at the prosecution policy. If somebody is caught breaking rules, whether they're administrative or medication based, maybe they are personnel based or something with patient care, we need to prosecute so that way the ethical foundation of our hospital stays excellent. What about the conditions of employment? You need your employee handbooks and or the job contracts for whatever positions to very clearly state what will happen if the rules presented are not followed. Then we're going to enforce our disciplinary system. You know, when somebody goofs up, it might just be a good person having a bad day. So you don't just want to fire people. What you should have is progressive counseling or a progressive disciplinary system in place. So that way you give them a chance to right what they did wrong. Also, just walking around the hallways, greeting visitors, acknowledging visitors by your staff. A lot of people are shy, but they have to look at people, let the visitors know that, hey, we see you, and we're also acknowledging you in case you need help finding someplace. Now, the wayfinding and the directional guidance kind of piggybacks on the number one when I talked about signage. So hopefully that is clear. Now, with the landscaping design and architecture, what we're talking about is CPTED, which is crime prevention through environmental design. So all 10 of these things, and there are actually a lot more, but all of these things should get into the mind and probably the subconscious initially of your staff, visitors, and patients. And again, it lets people know that security and safety is taken seriously here, and we probably just shouldn't even try anything.